Bowel disease isn't always visible, and many people are struggling with problems that others aren't aware of. This year, Bowel Research UK brought together a surgical researcher and a patient to talk about the importance of open conversation and how wider understanding can help with the unseen struggles of bowel disease.
Okay, I'm going to just ask you a few questions about your Crohn's disease. Just talk to me a little bit about when and how you were diagnosed and how that sort of has started to affect your life.
I think I was 14, 2005. I think I had a stomach flu. I was feeling quite feverish. I was having diarrhea and really tired, and I was losing weight. And it just persisted for weeks. First, the GP found celiac disease, which I guess is the most easy thing to diagnose. And then he referred me to a specialist, so gastroenterologist. And then I did a series of other tests. Yeah, they finally found Crohn's disease.
So thinking back to when you were 14, how did that impact on your day-to-day life?
Spending 2-3 hours on the toilet and then off to school and then back to the toilet, and it was just sort of pain and diarrhea and just misery.
I guess if you're having frequent diarrhea, then that must have meant that you were frequently visiting the bathroom. And
yeah, I had to map out. I pretty much knew all the public toilets in my hometown, knew exactly where they were and how long it would take me to get there.
Did anyone ask you what was happening? Or, friendships and things like that?
No, not really. People tend to not really talk about things. Not even just like gut things or sexual intimacy or anything like that.
Crohn's disease typically affects the gut, but there are a proportion of patients who it affects the skin, and a small portion of those have genital disease. So that's the area of my research that Bowel Research UK are funding. It's a really neglected area of research, so it's really important that we, fund this. And you've been really open with me about how it's impacted on your life.
I think there needs to be a concerted effort to just get people to open up, and it's not a big deal
about it up front. And this work with Bowel Research UK is really helping to get that conversation going and sort of empowering the patient to speak up, and that's not just to tell us about it, but to get some help and to help us to help them. So it is important for the clinicians to open those conversations and patients to feel comfortable with the uncomfortable when they're talking about it.